Right, welcome to part two, where we're going to look at the classification of ordinary connective tissue. So the learning objective for this section is to compare and contrast the structure, function and location of loose and dense connective tissues. These are the two different types of ordinary connective tissues which we find in the human body. So ordinary connective tissues are classified as, I say, ordinary connective tissue, or connective tissue proper is another term that they sometimes use. And it's divided into two types. It's divided into loose connective tissue, and it's divided into dense connective tissue. Loose connective tissue is a delicate type of connective tissue. It's about movement. It's about movement of substances. It's about a movement of cells. It's characterized by having a lot of ground substance. Obviously, ground substance is made up of water and gags, and therefore allows diffusion and things like that to happen. It contains few fibers, and the fibers that are present are actually made up of fine fibrils, so individual fibers rather than dense bundles of collagen. Dense connective tissue is actually further subdivided. So loose connective tissue is just classified as loose connective tissue, whereas dense connective tissue is further subdivided into two different types: dense regular connective tissue and dense irregular connective tissue. What's the difference? Well, it's about the orientation of the fibers within that connective tissue. Dense connective tissue as a whole, however, is about strength. It's about resisting stretch, resisting abrasion, those sort of factors. It has very little ground substance, so it's not about diffusion, it's about the strength of the collagen fibers and the collagen bundles, all resisting stretch and providing strength to that organ. And so it consists of many fibers, and those fibers exist in coarse bundles, big thick bundles of collagen, like ropes and ropes and ropes stuck together. And if those fibers are arranged in one particular direction, so they're transmitting force in one particular direction, then it's known as dense regular connective tissue. Or if the fibers are running in every which way to resist abrasion from any which way, then we call it dense irregular connective tissue. So here we've got a picture of the skin. The skin's made up of two layers: the epidermis, which is the stratified squamous keratinized epithelium, and beneath that we have the dermis. And the dermis is actually further subdivided into two layers: a layer directly beneath the epithelium, and then below that is a big thick layer of connective tissue. Of course, beneath the epidermis, beneath the epithelium, is of course a layer of loose connective tissue. We know that every epithelium has a layer of loose connective tissue. So it's made up of very few, very fine fibers, and it's made up of ground substance because it's got to allow diffusion to occur. And of course, within that region, we find capillaries because, of course, the nutrients are coming through the capillaries, they're being diffused out, and then it's receiving the waste from the epidermis as well. The dense connective tissue is the below that, which is the true dermis or the reticular dermis, and you can see it's made up of these big red purple bands, and these are thick coarse fibers of collagen and elastin. There's little ground substance, so it's not about diffusion. The fibers that are present here are running in many different directions, so it's actually about resisting forces from different directions. So this is a magnified view. So you can see in the sort of reddy purple at the top, those are the epithelial cells. And beneath that we have these fine little wispy blue fibers running down. And within there we find the capillaries, which are allowing diffusion to occur. So we're providing nutrition, removing wastes from the epithelium above that. Beneath that, we have these big, thick, coarse bundles of collagen. And you can see some are longitudinally sectioned, some are obliquely sectioned, some are transversely sectioned. And it's about big, thick bundles of fibers running in different directions to resist forces from different directions. So it provides strength as that part of that dermis there. So that's classified, of course, as dense, irregular connective tissue. So dense connective tissue can be collagenous, which is the most common type, or it can be elastic dense connective tissue. And it's a very unusual form, and I'll show you a picture of that towards the end of this section. Dense regular connective tissue, you can see the collagen bundles on the left-hand side all running in the same direction, and that's about transmitting force in one particular direction. So there's two types of dense regular connective tissue that exists in the human body. These are tendons, which attach muscles to bone tissue, and ligaments, which attach bones to bones. So they resist separation in that particular plane of force. Dense irregular connective tissue, the classic example is the reticular dermis, big collagen bundles, elastic bundles, running in many different directions to resist those forces from different directions. So if we compare them side by side, loose connective tissue has much ground substance, allowing diffusion to occur, few fine fibers, so a little bit of structural support, but it's not about strength so much. It may have many cells, but it doesn't have to. And we'll talk about why that is in a second. Dense connective tissue, little ground substance, lots of coarse fibers, bundles of collagen, few scattered cells. We tend to have more fibrocytes than we do fibroblasts, so they're more maintenance type of cells rather than the secretory cells. The fibers are either orientated in one direction or many directions, and of course its function is about strength and support, so resisting forces from abrasion and transferring forces. So going back to loose connective tissue, it may have many cells, but it doesn't have to. So here we've got a micrograph of a pseudostratified ciliated columnar epithelium with goblet cells. This is from the trachea. And if you see beneath that where we've got the loose connective tissue, labelled LP in this diagram here, we can see lots and lots of nuclei. There's lots of immune cells, lots of these transient cells coming into this region. Why is that? Well, if we think about it, the respiratory tract's actually exposed to the external environment, so it's a source for invading microorganisms to get into our systems and to our blood vessels and move around the body. And we know that a pseudostratified columnar epithelium, even though it looks stratified, it's actually only one cell layer thick, so it's really not much of a barrier to invading microorganisms. They can quite easily bypass, if they need to, this simple epithelium, even though it looks stratified. So in order to prevent that from happening, we have lots and lots of immune cells within the loose connective tissue beneath this epithelium. So it can be very, very cellular in order to prevent an immunological attack from invading microorganisms. But it doesn't have to be. So here we've got a section of skin. This is thick skin, so we've got a stratified squamous keratinized epithelium. All the cells are stuck together. We've got several layers of keratinized cells on the surface, so that's a real barrier. The cells are stuck together with lots of desmosomes, so it's a real tight epithelium, doesn't allow much microorganisms, and you can see within the loose connective tissue there's not that many nuclei. We don't have a lot of immune cells because the epithelium is the real barrier in the skin for invading microorganisms. It's a very good barrier for preventing infection. So if you cut your skin, get a little cut, it may get infected because you've then exposed the underlying connective tissue. But before that, the skin's usually a really good barrier to invading microorganisms. So loose connective tissue can be cellular, but it doesn't have to be. It really depends on the situation and where that loose connective tissue is found. So fibers are always irregular in loose connective tissue, so we don't really classify loose connective tissue into subtypes because it's just loose connective tissue. And then we have a mix of fiber types, collagen, reticular, elastic fibers, and so loose connective tissue is about support. It's about nutritional support, a little bit of mechanical support, but more about nutritional support. So it facilitates diffusion through its a large amount of ground substance. It facilitates movement of cells should those cells be required, immune cells particularly. Dense connective tissue, again, about strength and physical support, not so much nutritional support or metabolic support. So here's an example of this specialized dense connective tissue, which is elastic tissue. And we particularly associate them with the large arteries which leave the heart, which are called elastic arteries. Here we have lots and lots of elastic fibers bundled together into structures which we call elastic lamina. They sort of exist as sheets, a bit like a whole series of rubber bands that form the middle layer of this blood vessel. What this means is when the heart contracts, the blood leaves the heart and enters these blood vessels, and because they're elastic, they have all these elastic lamina, they're able to expand to accommodate that blood volume, and then because of the natural structure of the elastin, they naturally recoil. It doesn't require any energy, it's just a feature of their structure that they naturally recoil, like a rubber band that's stretched, recoils. So if we think about someone's blood pressure, we may have heard that a typical blood pressure is 120 on 80 millimeters of mercury. So when someone does your blood pressure, 120 millimeters is what we call the systolic pressure. That's when the heart's at contraction. And then the diastolic, which is the lower number, the 80 millimeters of mercury of pressure, that's called the diastolic pressure. So that's when the heart's at relaxation and it's filling up with blood. So even though the heart is not contracting anymore, the blood's still moving at 80 millimeters of mercury of pressure. How is that being brought about? Well, it's because of this elastic tissue. That natural recoil, as it recoils back from being expanded with that blood volume, is what maintains that diastolic pressure, that 80 millimeters of mercury of pressure. That comes about because of these elastic fibers. So this ends then part 2 of the module. There will be a short quiz which you'll need to complete, or you should complete, to give you a bit of feedback on your level of understanding of this short section, and then we'll come back for our last section just on adipose tissue, which again will be a very shorter section. So good luck with that quiz.